Abetalipoproteinemia, also known as Bassen-Cornzweig syndrome, is an extremely rare inherited disorder that affects the absorption and transport of dietary fats, cholesterol, and fat-soluble vitamins in the body. It is a type of lipid metabolism disorder that leads to a variety of serious health issues if left untreated. What is abetalipoproteinemia? Abetalipoproteinemia is a genetic disorder characterized by the body's inability to produce a protein called apolipoprotein B. This protein is essential for the formation of lipoproteins, which are particles that transport fats, cholesterol, and fat-soluble vitamins such as vitamins A, D, E, and K through the bloodstream. Without apolipoprotein B, the body cannot properly absorb these essential nutrients from food, leading to deficiencies that affect multiple organ systems. Causes: abetalipoproteinemia is caused by mutations in the MTTP gene, which encodes for the microsomal triglyceride transfer protein MTP. MTP is crucial for the assembly and secretion of lipoproteins that contain apolipoprotein B, specifically chylomicrons and very low-density lipoproteins VLDL. Inheritance: abetalipoproteinemia follows an autosomal recessive inheritance pattern, meaning a person must inherit two copies of the mutated gene, one from each parent, to develop the condition. If both parents are carriers, each child has a 25% chance of having the disorder. Symptoms: the symptoms of abetalipoproteinemia can vary in severity and usually appear in infancy or early childhood. These symptoms are primarily due to the malabsorption of fats and fat-soluble vitamins, leading to deficiencies that affect various bodily systems. Gastrointestinal symptoms: failure to thrive. Infants with abetalipoproteinemia often show poor growth and may fail to gain weight or grow at a normal rate. Steatorrhea: this refers to the presence of excess fat in the stools, making them bulky, pale, foul-smelling, and difficult to flush. This occurs because the body cannot properly absorb dietary fats. Chronic diarrhea: persistent diarrhea is common due to malabsorption, which can further exacerbate nutritional deficiencies. Neurological symptoms: ataxia. A lack of coordination and balance is often one of the earliest neurological signs, typically appearing in childhood. This is due to vitamin E deficiency, which affects the nervous system. Peripheral neuropathy: this condition involves damage to the peripheral nerves, leading to numbness, tingling, or pain, especially in the hands and feet. Muscle weakness: progressive muscle weakness may develop, affecting mobility and coordination. Ophthalmologic symptoms: retinitis pigmentosa. This is a progressive eye disorder characterized by the degeneration of the retina, leading to night blindness and a gradual loss of peripheral vision. It is one of the hallmark features of abetalipoproteinemia and is primarily due to vitamin A deficiency. Red blood cells may become abnormally shaped, spiky, or star-shaped due to fat malabsorption, and this condition is often visible in blood tests. Hematologic symptoms: anemia. Some patients may develop anemia, particularly due to deficiencies in vitamin E and other nutrients that are crucial for red blood cell formation and function. Coagulation issues: deficiencies in vitamin K can lead to problems with blood clotting, increasing the risk of excessive bleeding. Diagnosis: diagnosing abetalipoproteinemia involves a combination of clinical evaluation, blood tests, and genetic testing. Blood tests: these typically show low or undetectable levels of lipoproteins, particularly low-density lipoprotein (LDL and VLDL), low levels of cholesterol, and fat-soluble vitamins. Acanthocytes may also be present in the blood smear. Fat absorption tests: these may be conducted to confirm fat malabsorption. Genetic testing: confirmation of the diagnosis is made by identifying mutations in the MTTP gene. Treatment: while there is no cure for abetalipoproteinemia, early diagnosis and treatment can significantly improve outcomes and quality of life. The primary treatment strategies include dietary modifications. Patients are advised to follow a diet low in long-chain triglycerides fats and rich in medium-chain triglycerides, which are easier to absorb. This helps reduce gastrointestinal symptoms and improve nutrient absorption. Vitamin supplementation: high-dose oral supplements of fat-soluble vitamins A, D, E, and K are crucial to prevent or manage deficiencies. Vitamin E supplementation is particularly important to protect the nervous system and prevent neurological damage. The prognosis for individuals with abetalipoproteinemia varies depending on the timeliness of diagnosis and the effectiveness of treatment. With proper management, Many patients can lead relatively normal lives, although they may continue to experience some symptoms, particularly neurological ones. If left untreated, abetalipoproteinemia can lead to severe complications, including progressive neurological damage, blindness, and a shortened lifespan. Conclusion: abetalipoproteinemia is a rare genetic disorder with significant impacts on multiple body systems due to the body's inability to absorb fats and fat-soluble vitamins. Early recognition and treatment are critical to managing the disease and preventing serious complications. For those affected, a combination of dietary adjustments, vitamin supplementation, and regular medical care can help maintain a better quality of life and prevent the progression of symptoms. Abetalipoproteinemia is a chronic condition that, even with treatment, can have long-lasting effects on various aspects of a person's health. The after-effects of abetalipoproteinemia are largely due to the prolonged deficiencies of essential fats and fat-soluble vitamins A, D, E, and K that occur as a result of the disorder. Here are some of the key after-effects. 1. Neurological complications. Peripheral neuropathy. This is a common long-term complication characterized by numbness, tingling, pain, or weakness, particularly in the hands and feet. This condition results from prolonged vitamin E deficiency, which is crucial for nerve function. Ataxia. A lack of coordination and balance can persist, leading to difficulties with walking and fine motor skills. This is also linked to vitamin E deficiency and may worsen over time if not adequately treated. Cognitive impairments. Some patients may experience cognitive difficulties, including memory problems and difficulties with concentration, particularly if neurological damage was extensive before treatment began. 2. Vision problems. Retinitis pigmentosa, a progressive degeneration of the retina, leading to night blindness and loss of peripheral vision. Over time, this can result in significant visual impairment and, in severe cases, blindness. Night blindness. Even with treatment, some individuals may continue to struggle with night blindness due to earlier vitamin A deficiency. 3. Musculoskeletal issues. Osteoporosis and fractures. Long-term deficiency of vitamin D and calcium malabsorption can lead to weakened bones, increasing the risk of osteoporosis and fractures. Muscle weakness. In older chronic patients, muscle weakness may persist due to long-standing nutritional deficiencies, affecting mobility and physical activity levels. 4. Hematologic complications. Anemia. While treatable, some individuals may continue to experience mild anemia, especially if vitamin E levels are not adequately maintained. Coagulation problems. Due to vitamin K deficiency, there may be an ongoing risk of bleeding disorders, particularly if the vitamin supplementation is not optimal. 5. Gastrointestinal symptoms. Chronic digestive issues. Some individuals may continue to experience digestive problems, such as steatorrhea, fatty stools, and bloating, even with dietary modifications. Conclusion: the after-effects of abetalipoproteinemia are multifaceted and can significantly impact various aspects of a person's health and quality of life. While early diagnosis and proper treatment can prevent or mitigate some of these complications, others may persist despite optimal management. Ongoing medical care, dietary management, and supplementation are crucial for maintaining health and preventing the progression of symptoms.